POTS, some orthostatic intolerance conditions like neurocardiogenic syncope actually are fainting, but POTS patients typically don't faint, particularly if they realize the warning symptoms of lightheadedness and fatigue and sit down or get horizontal. But it's not a sudden loss of consciousness condition typically.
I realize sometimes, like when I'm at the grocery store, if I'm trying to get something off the bottom shelf, I might lean down and then stand back up, and then it just kind of like blacks out. I don't ever really like faint. I don't like fall backwards and
It's kind of a gray
yeah,
out
just
instead of
everything
a
gets black, and I
out,
have to
right.
steady myself for a minute to like, you know, not.
That's a pretty good demonstration of postural changes in blood pressure and blood flow. Your heart, your blood flow to the brain is just not able to rapidly equilibrate, going from head way down to head fully erect, and you feel that momentary drop off in blood flow. So, but have you actually passed out that many times?
No. The only time I ever actually fell down was long before I knew I had POTS, and I was on Claritin. So.
So another therapy that we commonly use, we use IV saline therapy here in the office. We do it. POTS patients, many POTS patients in general dehydrate very rapidly. That was why the recommendation at the prior diagram for salt loading and fluid loading. Sometimes taking it orally is just not enough, and you cannot get the volume into your system. So we give it directly intravenously. I do that here in my system, in my office, I'm sorry. And we have a little video.
Yeah. So we'll show this to you guys. This is just what getting a normal IV for saline therapy looks like.
All attendees are muted. All attendees are muted.
YouTube is dysfunctional. Are you doing anything about it?
No. Well, you can see right now in this video I'm getting the saline therapy, and generally this takes us about 1 hour.
Right, I start the IV. She's a good subject. She doesn't even blink when I put the needle in. I use a 31 gauge, I use a 21 gauge butterfly needle. I give her 1 liter of 0.9% sodium chloride or
hold on,
saline.
They can't hear us.
Oh. Okay.
Whoops, sorry. I guess you guys couldn't hear us. All right, so that's back on.
Okay, so let that go.
All right, so well, you guys can see the video. We'll post a link to it later on.
Basically, I give her, give the patients a liter of saline. As you can see, there's a full liter there. I actually, it's yellow because I put a cc of vitamin B complex in there because sometimes your nutritional balance is not great.
Right. Amy is asking right now, should we have our vitamin levels checked regularly?
I think it's wise to check certain things. Absolutely. B12, the B vitamins, particularly thiamine, B1, pyridoxine, B6, vitamin B12. It depends on how bad your nutritional status is in a given period. For instance, I know you've had time periods where you couldn't drink anything but Gatorade for months at a time, or Propel.
I'm having one of those days right now.
Right, because of the gastroparesis and the gastrointestinal issues, you just couldn't eat food.
Right.
And, your stomach would process Gatorade, but guess what? There isn't, Gatorade is not full nutritional value. For one thing, like I said, it lacks B vitamins and many other things. We get our nutrients, our vitamins, minerals, etc. from our food. And when you're not able to eat for prolonged periods, it's inevitable you're going to become deficient. So I do test for things, particularly when someone's telling me that they're not able to eat and they're on just liquids.
Yeah, they're saying tons of sugar in Gatorade.
Lots of sugar. There's electrolytes. There's sodium and chloride. It's about the same concentration as blood. So that's one of its virtues. It has an osmolality about 300. That's the same fluid concentration of electrolytes as blood does, but it doesn't go in directly. And like I said, unless you added some vitamin packets to it, which you could well do. It doesn't come stocked with vitamins.
That would taste so gross.
Well,
So
we can give it the intravenous.
there was one question. If you have high blood pressure, is it still okay to get IV therapy? Is that still a good idea for you?
It would depend on your state of hydration, and we can assess that by blood work and checking electrolytes and other parameters. But it's unlikely that a person with high blood pressure is going to be as dehydrated. Typically, if you dehydrate, one of the things that happens is your blood pressure drops. So
Right.
someone comes to me, they have high blood pressure. I mean, it's unlikely that their volume depleted or dehydrated.
There's another question with this. I didn't know in the beginning that I was dehydrated. Now I understand the signs and symptoms of dehydration, but what are some things that you should be on the lookout for dehydration, just in case they're not familiar with being
Well,
dehydrated?
we can diagnose it. When we do a blood test, we'll check your BUN and creatinine, the kidney parameters, sodium and chloride. You can tell when you're dehydrated by enhanced fatigue and accelerated heart rate, more dizziness or faintness. You're not peeing at all because sometimes you're not putting out fluid. You may be extra thirsty. But I think once you receive intravenous saline, if you are a patient that qualifies for that, you'll start to notice the feeling, and then you'll remember that. So in your mind, when you start to become dehydrated again, you'll realize, oh, I'm dehydrated, because I remember the feeling after hydration. And I think that's part of it.
I think there's something else we should mention too, because Dr. Santa Maria allows patients to come to his office and have their IV saline therapy in the office, but that is not the case for most POTS patients and POTS doctors. But there are a couple of places that you can go to get IV saline therapy once you have a prescription. You can actually have it done at home through home health care, through your insurance.
Home health care, right.
There are
walk-in clinics
like those emergency rooms, those
not Walgreens.
No, not Walgreens. Just in case you.
Yeah, exactly. I mean, obviously, as a community-based internal medicine physician, I've made it my business to study this subject, learn as much as I can, help the patients as much as I can right here, because I know it's very taxing and difficult to go to other places and deal with bureaucracy and waiting times and temperature differentials and what have you. And so I try to make it as easy as possible for people who can come to the office to get these things done, so that there's minimum wear and tear.
Yeah, it seems that like if you're already having a very bad episode and then you have to go through the 6-hour process of being in an emergency room, you get past the point where it's going to be beneficial for you to have one bag of saline.
Right. It sort of defeats the purpose. Exactly right. So that's why we do this quickly. I have a comfortable chair. It's air conditioned. We get the first person in, do the IV, and get them out again.
And you can watch that video so you can see what the whole experience is like. So how, there's just one question about it. How frequently do you give IV saline?
It varies person to person. Some people, need it once in a while if they're going on a trip or doing something special, or and other people come on a regular basis. They have a regular appointment once a week that seems to carry them over for a number of days. And there are people who benefit from getting it very frequently. Every day, every other day, 3 times a week. So, I try to gauge it to the individual person and their response. And, like everything else, I try to listen to what they're telling me, watch for the signs and individualize their therapy.
I know we had, in the beginning, when I first started the saline therapy, it took about 3 weeks for me to kind of get to a point where I was consistently hydrated. And once I was, I could go about once a week, needing like one.
Right. So initially you may need more.
Yeah. And sometimes if you're having a really bad flare, you might have them once every 2 weeks.
Right. Exactly.
If you live in Florida in the summertime, you'll probably need it once every 2 weeks.
That could happen. And I remember when you first came to me, you were also vitamin depleted, and you had some skin cracking and other signs of vitamin B deficiency, and that seemed to resolve fairly quickly with giving intravenous B complex. So that was helpful.
Very. Okay. So medications. I know we talked a little bit about this. And I think on the next slide we have, that's.
Yeah, I think we'll have more questions about medications. Maybe we should just save this because people want to ask some specifics
Specific questions
about medications. We can
So we'll come back
to
to that.
Yeah, sure.
So let's talk about cardiac rehab.
Cardiac
What
rehab,
is that?
basically cardiac rehabilitation programs are, as you can see here, you see a person who's exercising with monitoring. You have a trained, usually an RN, who's monitoring his blood pressure, heart rate, and response to the exercise, and doing a graded increase. The initial assessment involves finding out what you can do comfortably, what your heart rate and blood pressure will tolerate, and then putting you on a graded program so that you're always increasing your exercise capabilities, but with monitoring such that it's safe and you feel that you're not going to faint and no one's going to know it or whatever, so that they're monitoring you progressively and increasing your exercise capability with under their watchful eye. So.
I think I've done cardiac rehab before. I did it for about 6
Mhm.
months, and I had a great experience with it. When I first started, I didn't think that I was going to be able to do it, just because one, I had never exercised before in my life
Right.
prior to POTS,
Right.
and now I was so bedridden and blacking out all the time. It seemed like this was going to be almost kind of dangerous for me to even try. But my experience with it was very safe,
Mhm.
very contained. I always had a heart monitor on. I was next to nurses who specialized in,
Right.
in this kind of
Exactly right.
rehab.
Mhm.
So it actually is a great environment to go ahead and start your rehabilitation. So I think we really
And doing it
recommend
in a
that.
program like this is great because the nurses write
Keep
down
track,
progress and they send it to me periodically so that we can see that the person is actually making some progress. And at least in the case of Boca Raton here, Boca Raton Hospital, they have a great cardiac rehab, which is very reasonably priced.
And my insurance did cover it, yeah.
Right, insurance may cover it, but even so, I asked them today, and they said it was $300 for 13 sessions. So 13 sessions of monitored, graded exercise, I think that's pretty reasonable.
Yeah, I think I paid about $20 in co-payments.
Yeah, about $20 a session, or thereabouts, which for the benefit that's achieved, that's as good an investment as anything you could make.
The goal with cardiac rehab is you're only supposed to do it for, I think, a couple of months. Sometimes people do it longer depending on their state. But ultimately, your goal is to be able to exercise on your own so that you can join a gym and feel comfortable, know you're supposed to be, you're supposed to learn about your body and see, I'm getting to a point where I'm going to be sick, I have to stop, or, I know what machines I can use and how to use them safely.
It's almost in a way a form of biofeedback because you're exercising, they're telling you what your heart rate, what your blood pressure, and then you start to become attuned to it. You could say when you're exercising on your own, this is good for me, and my heart rate's good, my blood pressure's good, I can continue, or I need to stop now. But it gets you to a level where you can pretty much function on daily activities.
It helps you push yourself too, because if I was alone in a gym trying to go on a treadmill and I felt, faint or something, I might just stop it right there. But knowing that I was monitored and that I was being looked out for,
you don't have the panic.
Yeah,
factor.
And you don't need the anxiety of it on top of that. That's just
absolutely.
enough.
Absolutely. So it's a great resource, and most everybody can take advantage of that if you get a doctor who's involved and interested and can set it up for you.
Right. That's good. So let's talk about diet and what sort of foods and drinks that POTS patients should be focusing on.
Well, obviously, we want to retain volume most of the time. The vast majority of POTS patients have venous pooling, low body blood volume, dehydration, we talked about. So to rehydrate, we take a lot of salt and a lot of water. Taking plain water without salt will simply dilute your body fluids.
Don't do that.
So we take both.
Yes.
We take lots of salt, sometimes 8, 10, 12 grams a day or more of sodium, and lots of water, and that helps.
So is salt necessary if your blood pressure is normal or even high?
If you have high blood pressure, you're not going to want a salt load. or you're going to want to monitor your blood pressure as you do it.
Hmm.
And that's going to be, that's where the symptoms come in. You may feel better when you take more salt and more fluid. You may not feel the difference, or you may feel worse. You may have headaches or
Hmm.
pounding or whatnot. But the vast majority of POTS patients, do better with lots of salt and water.
And there's a lot of like conversation about gluten-free dieting and celiac disease and how that relates to POTS, because there seems to definitely be an overlap in the community. So what do you think about all POTS patients doing gluten-free foods? Is that something they should all be concentrating on?
Well, as you know, obviously the gastrointestinal tract from your stomach, the small bowel, large bowel is under autonomic nervous system control, so it can be dysfunctional in the dysautonomia spectrum, and you may find that you don't tolerate certain foods or elements like gluten. Gluten is not an essential food in the human diet, so you can certainly try without it and see if it makes you feel better. If it makes you feel better, that's really the bottom line to that.
Yeah. All right, well, let's save any specific questions. Let's move on to what sort of things should a POTS patient avoid?
Okay, so dehydrating things, hot tubs of excessive heat and humidity,
Tanning booths.
food,
Don't do that anyway.
right? And things that rapidly change your head position, roller coasters, and unfortunately fast elevators.
Yes.
And because your blood flow to your brain and heart just don't react quite as quickly in microseconds like it does in other people, or perhaps when
Sharon
you're
wants to
younger.
know, can't go skydiving?
You can. I mean, you'll hit the ground eventually, but you won't enjoy the experience. I guess we should sort of said here, what are things will POTS not enjoy?
Yeah.
And bending up and down. Alcohol and caffeine really should top the list of no-nos, particularly
Yeah.
alcohol. Unfortunately, it dehydrates us and makes us loopy. We don't need more brain fog
I've heard
or
some of the girls on
confusion.
the forum say that they'll drink one drink and they'll drink 2 bottles of water and then one drink and then 2 bottles of water.
Dilute it right away,
Yeah.
sure. Or yeah,
Kind of
exactly.
defeats the purpose, but okay.
Well, at least you're being social. I don't know, but you may regret it next day. I guess basically a lot of times you'll be tempted to try things and do things, and
You have to test your limits.
right, and next day you may say that's definitely not for me. I don't want that. I'd rather feel good and not eat whatever it was or drink alcohol at a party. But
Yeah. And then there are things on here, blowing up balloons, excessive stair climbing, energy
blow,
drinks.
blowing up a balloon is the Valsalva maneuver. By the way, we talked about that earlier. That's exhaling against the force resistance. That drops blood down to your legs,
Hmm.
which definitely doesn't make you feel comfortable.
Right.
Giving blood, that's a good one.
Yeah, might
We
not
want
want
to
to do
take out
that.
more volume. We want someone to give us blood.
Hmm.
And singing and blowing instruments are again another more forms of Valsalva maneuver.
And then travel by airplane can sometimes be difficult for POTS patients, but some are okay with it. Some manage to do
We
all right
all
with it.
tend to dehydrate at high altitudes, and that's part of it. The cabin pressure is somewhere around 5,000 feet, I believe, and so make sure, and they never want you to drink. I mean, they don't want you to take a bottle of water on the plane because you might blow it up or something, and you need to drink a lot of water when you're
Yeah.
flying, so do
All
the
right.
best you can.
So let's talk about compression stockings and abdominal binders.
So for people who have the most common form of POTS, neuropathic or venous pooling, putting pressure on the lower body, whether it's the legs or the abdominal cavity, can force blood return to the heart and make it easier on the heart to work.
And people seem to realize that they have this when they get out of the shower.
Hmm.
And they like after they've been standing in the shower and they look down at their legs and their legs are all like
Sure,
spotty or
because heat makes your
yeah.
blood vessels dilate on your
Hmm.
skin. Let's face it, when blood is dilating on your skin, it's not going back to your heart, so it's being shunted away from your uh, central circulation. Same thing happens when you eat. Blood has to go to your intestinal tract to aid digestion, so it's not a good time to be exercising um, or running around because blood has to go preferentially one place or the other.
So you can get compression stockings and abdominal binders pretty much at any
Yeah, all
surgical
kinds of
store.
places. Amazon,
Doctors can prescribe
right.
them.
Under Armour even has a line, recharge suits and other garments.
So POTS emergency, what's that?
Well, POTS emergency is when you can't even stand up straight, fainting, feeling faint, heart rate racing, um, sometimes pain or particular abdominal pain. Another complaint that often brings the POTS patients to our emergency room is severe headaches, migraine,
Yeah.
abdominal pain, migraine, very fast heart beating, and those are the kinds of things that make you feel really bad
Really out of
quickly.
control.
There
Yeah.
you go.
So, all right, seems to be a huge problem for absolutely every POTS patient ever in existence. Is how do I explain POTS to an emergency room doctor?
Well, the first person you're going to see is a clerk behind a desk, and then a nurse, and then the doctor. So my suggestion is don't use the word POTS, because they're all attuned to pot and drugs and things like that, and they don't know what it is anyway. You really need to tell them, I have an autonomic nervous system dysfunction, or I have orthostatic tachycardia, or some type of technical terminology that will get their attention, because a lot of them are half listening, and you say POTS,
And they hear marijuana.
and they hear marijuana or something else, and they're just used to
And
blanking out when they
seems
hear
if
that.
you come in there and you're like, I want an IV or I want pain medicine, automatically they're going to be like, you're a drug addict.
You're a seeker, right?
Yeah.
Exactly. And their antenna are always up looking for seekers of and abusers. And so if you're there legitimately, you don't want to be abused yourself. Say, I feel very faint. I have autonomic dysfunction. I have orthostatic tachycardia. I am in pain, perhaps, if that's your problem, and I am probably dehydrated. And can you help?
You'll also ask them if they can, if you have a regular doctor who's managing you or a cardiologist, you might want to ask them to give them a call. There's also a page on Dr. Santa Maria's website that has information on saline therapy that you can print out and bring in. I know other patients have done that and brought it to the emergency room and gotten their liter of saline and been out the door.
I think as doctors, a critical function, I really want to emphasize this. If you go to an emergency room, bring a list of your current medications. That's critically important, and medicines that you don't tolerate. Have it printed up neatly so that anybody could read it, and hand it to them, because the time wasted in finding out what medicines you are, how many milligrams, how often, you'll go crazy and they'll go crazy, and it really diverts their attention from the problem at hand.
Right.
Bring a list of medications and dosages and medications you can't take, if nothing else.
So what about what can be done while you're there to treat your symptoms?
Well, depending on your symptom, you may have fainting and fast heart beating. They're going to take an electrocardiogram. If you have a severe headache, like as not, unless they know you, they're going to want to get a CAT scan or some imaging study. If it's abdominal pain, they may do other x-rays. And then once they've determined something about the cause of the problem, they'll treat you. Again, you may get saline, you may get pain medication, whatever is appropriate to the circumstance. But at least they can give you something to get you through the crisis. Hopefully call your doctor who knows what to do next.
Yeah. And so you're out of the emergency room and now you have to find a doctor to treat you full time. So what do you do if a doctor won't treat you or doesn't comes in with an attitude where he doesn't believe in POTS, like POTS isn't a real thing?
As doctors, we're faced with millions of different conditions, and POTS is a slice of our practice, but may only be a small. So you really have to, as a doctor, go out and purposely inform yourself. If the doctor is completely adverse to learning or not interested, find somebody else. And the forums and websites like DNET and Dysautonomia SOS and what have you can often give you some lead in your area to doctors who are knowledgeable in some way. Now, if you find one doctor, say a cardiologist, electrophysiologist, neurologist, somebody who knows something about it, your internist, they can often point you to the other doctors because they know them. We deal with each other on a daily basis, and I know who's interested and who's knowledgeable, and I can help direct you from there. So finding the first entree into the system is often critical.
And be a friend. If you find a doctor who treats POTS in your area, post it online so that other patients can benefit. You never know if there's a doctor right next door to you who
That's
knows
true.
all about POTS.
Or what happened to you the other day? I sent you to a cardiologist, and when
I
you
went
said
to a
I have POTS,
cardiologist. I told the nurse there, I'm like, I have this thing called POTS, and there I am waiting for her to say, what is POTS? And she's like, you have POTS? I have POTS. And I
great
was like,
connection. And you didn't even know about her, right?
yeah,
But or each other. But
yeah,
sometimes you get lucky like that, and then you have an entree. The doctor's nurse has POTS, so
yeah. And just
perfect.
I think one thing that's good to mention too is that, for probably a long period of time for all patients, they've been told this is all in your head, this is anxiety, this is, something that you've done to cause this is Munchausen's by proxy, this is, a million different things but POTS.
Anxiety. Yeah.
But frankly, for the majority of patients who have had the tilt table test and they've been diagnosed and it is POTS, it's not all in your head. And you need to have the confidence as a patient to advocate for yourself and to move on when a doctor does not want to help you.
There's actually been a huge number of articles published over the last 20 years. Is POTS real? Is dysautonomia a real disease? And the overwhelming answer is yes, absolutely. And when they scientifically analyze it and study, there's no doubt about it. We've showed you some of the tilt table things and Valsalva things.
It can be tested. It can be treated.
Exactly. There's extensive literature documenting that yes, it is a condition, and yes, there are ways to treat it.
So let's talk about some diseases that are commonly associated with POTS, because I know generally a POTS patient may think they only have POTS, but in reality they end up having 3 or 4 different diseases they didn't even know.
Or they have the other diseases, and eventually they develop POTS,
right,
and they don't even realize they've segued into it. So commonly connective tissue disorders are associated, like Ehlers-Danlos, right? Joint hypermobility, Marfan. These are all diseases of dysfunctional connective tissue, and somehow the connective tissue is associated with POTS. Probably the walls of the veins are not as strong as they should be and allow pooling of the blood in the lower extremities. That's one theory. But there is a high concordance with the connective tissue disorders and dysautonomia in general, and POTS in particular. Another one would be Chiari syndrome, in which there's some degree of herniation of brain contents down into the spinal cord canal, which can compress the spinal cord.
That's an interesting one. You can only be tested for that one way, right? That's some kind of MRI or.
Well, the MRI is definitive. That's the ultimate test. You can see on a lateral MRI of the spine of the lower brain and spinal cord, you can see the contents of what the brain should be in its cranium actually moving down into the spinal canal. That's pretty classic. But some people actually have Chiari, and it doesn't show well on the MRI. And then you need a high index of suspicion and a doctor who's extremely adept at diagnosing it, like Dr. Bolognese in New York. Probably the best there is.
And then there's mast cell activation disease, also known as MCAD in the cat, right?
Right. Well, mast cells is a whole topic unto itself, but mast cells basically are cells involved in allergic reactions typically, but which contain a huge number of chemicals and mediators, among which is histamine. So that people who have mast cell activation often have overproduction of histamine symptoms like flushing, heat, itching, those types of things.
Sometimes, making me itch as you're talking about it.
Flushing too, though. And that's a classic place, the anterior neck or face, so suddenly turn very red, hot, and flushed, and
kind of like a hot flash, people say.
At 18 years old, right?
Yeah. So, and then what about autoimmune diseases and immune deficiency diseases?
Well, again, high concordance with autonomic diseases, and many of the patients with autonomic nervous system dysfunction can be proven to have autoantibodies. An autoimmune disorder, of course, is a disease in which your own immune system is attacking your own body tissues. In this case, perhaps the sympathetic nervous system receptors, and that's a whole area that's really developing rapidly now. So there may be some autoimmune link in many cases of POTS. I mean, we certainly can't diagnose it in all cases. But
It's definitely hard to put the puzzle together, but what is the initial presentation of POTS?
well, the initial presentation, of course, is rapid heartbeat for no reason. Again, it's inappropriate sinus tachycardia. By definition, it's rapid heart beating for no apparent reason. In other words, you're not running, you have been scared, you didn't take a drug, your heart rate is going way too fast, and you're feeling faint. And many people, interestingly, it comes on very suddenly, or literally, perhaps in hours, or certainly in a course of days. People can go from very fit, fantastic feeling to suddenly can't lift the head up
Yeah.
without feeling extremely faint. And
There was one girl we
tachycardia
had at one of our
support
support
group.
groups who was an athlete. She
She
was
was running
running
right 8-9
every
miles a
day,
day, and
and
within
then
the week,
suddenly in the hospital in like the ICU couldn't get
well,
her
she
heart.
could right. She
Yeah.
told me that she couldn't even lift her head up off the pillow without feeling faint, and then with her heart rate suddenly jumping up into the hundreds. And that's very so. This can often follow suddenly on the heels of a viral infection, a pregnancy,
Car
a
crash.
car accident, a mononucleosis, or for no good apparent reason. But,
Yeah.
you know, but those are settings in which it commonly happens. And you know, POTS itself affects females much more than males, probably something like 4 or 5 to 1. And it often seems to be younger people where it comes on. So the classic profile would be a young teenage girl, 14, 15 years old, after a case of mononucleosis or viral syndrome. Yes, exactly. You fit exactly that profile. And now everybody's wondering how come they're not getting better? Why are they complaining of you get still feeling faint, no energy, heart beating fast, and that can be very vexing for a while until you get to a diagnosis.
So let's talk about where to find a POTS doctor, because that can be a hard one, because this is, you know, people are all over the country have this, and it seems like as a POTS patient that there may only be 3 or 4 doctors actively out there marketing their practice as POTS specific.
Well, basically, I think what you're asking in a way is POTS specialists, people who research and study POTS all the time, versus community-based doctors who can treat you on an ongoing basis. So the specialists, we mentioned some of the places like Mayo and Vanderbilt, et cetera. They're extremely versed in all aspects of dysautonomia, diagnosis and treatment. They can give you some precise ideas on what you've got and directions for treatment. When you get back to where you live, you have to find a doctor who can implement those things on a daily basis, because you can follow their treatment program, but you're still going to have day-to-day or week-to-week problems come up, and they have to be dealt with. And it's very hard to interact sometimes with a researcher who's dealing with thousands of patients and generating data. So there's a role for the specialists and the centers, and there's a role for the community-based doctor, and hopefully they can interact and work together to help you.
So at the end of the day, like, you can go and see one of these specialists like Dr. Grubb or someone, you know, in another state, but you need to always have someone managing your treatment back at home, who can, because POTS ends up having a million different symptoms.
Right. Dysautonomia is like different almost sometimes every day. There's a new.
You may need a new drug every week, or you know.
Unfortunately, that's sometimes the case. Sometimes there's long periods of stability where it's just migraine headache or just tachycardia, but sometimes things are rapidly changing, or you may pick up the flu or a sinus infection or get injured or something that's going to destabilize the whole spectrum of your dysautonomia. And someone has to be able to react to that quickly and deal with it. Otherwise, you're going to be very sick with nowhere to really turn immediately.
You need someone to watch over you, kind of.
We as doctors need the researchers and the people who study this to give us direction on how we're going to treat and what we're going to do. So we all try to interact and work together.
So a couple of ways that we spoke about maybe finding a POTS doctor. One was to go through your insurance company. And what you would have to do is find either maybe a cardiologist or an internist, go through the list, literally call them up and ask the secretaries, Does he have any POTS patients? Does he treat any POTS patients? Does he know what POTS is? And if they say, are you on drugs? You know, you have to explain it to them. They're probably not the right doctor.
In effect, what happens is a lot of people realize that tachycardia or some heart symptom is their first symptom, and they'll end up with a cardiologist or electrophysiologist, usually a community-based cardiologist, and they generally have some idea of what they're talking about, because we as doctors deal with orthostatic intolerance all the time. There's various forms of conditions that occur when people stand up. They get sick. Maybe their heart goes slow, maybe it goes fast, but the cardiologists generally have a familiarity with that system. They may not know much about the gastrointestinal complications or the peripheral neuropathy or the migraine, but at least they can get you started.
Right. You can also check on the POTS support groups on Facebook online, and you can also look through different directories at websites like Dynet and Dysautonomia International. There are resources out there, so you just have to ask around. You can also ask when you're in the emergency room if any of the doctors know of any treating physicians who are familiar with the disease. So, what questions should I ask a new doctor?
To take my insurance.
That's probably number one.
How about do you know what POTS is first, and then do you take my insurance? But again, a lot of times, like I said, your good entree to the system will be another doctor who knows something about POTS, and then something
is willing to do the research,
to who to
speak
go
with
to.
Other people.
Yeah, get you to an internist or a family doctor who can kind of manage things on an ongoing basis, because we have to pull together all the systems, and I don't want somebody going to a neurologist and cardiologist and gastroenterologist and getting conflicting advice and therapies and drugs that are maybe good for migraine but mess up the stomach, or maybe good for the stomach and make the heart go fast. So someone has to integrate all of that, and it's not easy to find such a person.
You want to ask about things like how many patients do they have, because POTS patients generally need a lot of help and a lot of time.
Or just, are you willing to learn about it?
Are you willing?
Can I give you some information? Will you read it and help me?
Generally, you can tell by a doctor, if you can go in for your first meeting with them, first appointment with them, and kind of sit down and interview them and ask them if they're willing, if they're open, if they have the time, if they have the patience, if they're willing to speak with other physicians. And if they come off with an ego like, I'm not talking to anybody, you're crazy.
Basically, if the doctor and his staff are sympathetic, as opposed to being parasympathetic, you stand a chance. At least if they're, empathetic, really, that they may listen to you and help you and try to learn more about your condition, which is sometimes all you can ask.
Right. All right. So we had a lot of questions in our emails. How can students cope with POTS while in school?
You take that one because you're a
student
that coped with POTS.
Yeah, yes. I had POTS throughout high school and college. So this is one thing that you want to start with. You want to start with getting a 504 and IEP plan, which is a disability plan. You can go in and speak with your child's principal, their guidance counselor, and you should be able to sit down and work out a sheet that has accommodations that they need and they're looking for. And you have to get documentation from your physician saying, my son or daughter has this issue and they need to be able to leave class. They need to be able to be excluded from the absentee law, which is possible. There is an exclusion for people with chronic illnesses. When I was in high school, I actually, for the last semester or two, ended up going to school for 1 hour a day and then having all my teachers giving me my work at home.
At least they had some understanding. They knew you weren't malingering. They knew you weren't trying to cut classes. You were really having an issue.
Students with POTS, of course, they're going to go through their entire childhood if they've had this with their parents not believing them, their teachers not believing them, their doctors not believing them. So hopefully by the time they get to high school, they'll have a little bit more support, and they'll really need it because it's a very stressful time in their lives to have such a hardcore, stringent schedule.
And that's part of the journey, dealing with POTS from diagnosis to coping. You have to get support system and other people on board. And sometimes your significant other or your family members just don't want to believe there's something really wrong with you. They think you're putting it on, and that's very frustrating.
But you're not crazy. You're not.
No, absolutely.
There are almost 80 people in this room who have the same disease you do, so it's out there. A couple of other things. Hospital Homebound is a program that's available to students in public schools. If your child is in a private school, I would actually recommend that you switch them over to a public school, just because public schools have a lot more support for students with disabilities than most private schools will.
Can you say they have the law or
There's
mandated
law.
that they must
There's
make accommodations?
right.
in
There's
public
mandates and there's laws that public schools have to follow when it comes to students with disabilities that private schools don't have to care about. So
That's an interesting point you made that I didn't know about. So
yeah. And then there's also virtual school programs now that they can do completely online. And you know what? It's a good thing for them because POTS patients probably are not going to be able to work a normal 9-to-5 job and are going to have to learn how to make their living in a very self-sufficient kind of way. So it gives them a lot of discipline and a lot of education on how to, plan for their symptoms and plan for their work and balance their lives. So I think that's a great thing for them actually. So we'll come back to that if you have any more questions on that one. And then we can learn more about Dr. Santa Maria. You can go to his website, which is www.santamariamedicine.com. On Facebook, you can search the group Dysautonomia Florida, and that's our group. And you can also email him at potsresearchproject@yahoo.com. So, all right. So now we've had a million questions in here during this time. So I'm going to scroll back up to the top, and we're going to take just a couple of minutes now because we've gone over a lot and we're kind of over our time limit. But
I see one question about, I'm in the workforce, I developed POTS, and now I have to try to cope on my job. How do I convince them or get disability or that could be very difficult. I mean, you're going to have an uphill battle because you have an invisible illness. An invisible illness means you look fine most of the time, and most of the time you're trying to look healthy and fit in, but you're weak. You don't have the energy. You may get dizzy. You may be sick. You may have migraine. You may be vomiting, and you may end up missing so much work that they actually let you go. So that's a tough place to be. But
there are patients that have gotten disability for POTS.
Yes.
Very far and few between.
Yes.
It's a very difficult, long, expensive process. So don't be fooled into thinking you can go ahead and just sign up for disability.
It's true, but I have done examinations for Social Security Disability Department for many, many years, and I can tell you that if you're persistent, often get an attorney, take it to an administrative law judge who's the final arbiter in your decision. You can often convince them of the merit of your case, and they'll give it to you if it's legitimate. But you have to be persistent, and that's hard when you're tired and headachy and nauseated and what have you.
Yeah.
But
so let's see. How do you get a spouse to be empathetic?
Well, when they see you trying to do things and falling down, or say, feel my pulse, how fast my heart's going, or I have tonight I have a headache. Eventually, most of them get the message. I've seen on the forums even some couples where the other person has gotten POTS and said to them, now I know what you're talking about the whole time, and I have it. But hopefully you have that kind of a relationship where you have communication and they can see that you're not putting it on. But it's difficult for the spouse. Let's face it, they have to pick up a lot of the slack. They have to do all the child care maybe, and cleaning, cooking, and everything else. But
I think it's important
you're not doing it to get attention. Let's face it.
Yeah. I think it helps as well if you kind of divvy up the support that you need, not just between your spouse, but between your family, your friends, your doctor, and you don't make them the center of responsibility, because you want to be able to retain that relationship with them.
That's a good point. Like try to shift the workload around.
Yeah. Try to balance it.
Yeah.
If a friend can help pick
Give
you up,
a ride somewhere.
yeah.
Or something. Right.
If you have a parent that can take you in the middle of the night to the emergency room one week, and then have your husband take you the next week, and kind of just try to give them space. And yeah.
It's great to have a loving support group, let's face it, because otherwise you can get depressed over, I can't do this, I can't join my friends, I can't go on the roller coaster, I can't go out for pizza. And they have to be pretty understanding to help you get through that.
Yeah. I'm just scrolling through the questions here. Oh, let's talk about IVIG and POTS.
Okay. So as another associated condition to POTS or dysautonomia, sometimes people have primary immunodeficiency. Immune deficiency means, in this case, that you're not producing enough immunoglobulins to fight various kinds of infections. So IVIG means intravenous immunoglobulin. And the solution is usually IgG. That's what's being made in there. It's highly purified. It's sterile, so there's no infection in it, and therefore very expensive. But it's used to boost the immune system against primarily bacterial infections. So if you're getting frequent infections and don't seem to be able to kick them, certainly I will check the immunoglobulin spectrum. It's very easy blood test to do, and sometimes you'll find out there's a glaring immune deficiency, and you may have a candidate there that for intravenous or also subcutaneous
Yeah.
immunoglobulin. There is also a form which can be administered under the skin, but basically it's not something you can take in a pill form.
Right. And it's also very expensive and very difficult to get approved by your insurance company. So you will need to have those tests done for.
But if you have the valid immune deficiency profile in your lab work and repeated infections, and doctor will advocate for you, it can be done.
I'm just reading through all these questions, so give me a second here.
Okay.
So what do we think about ports for the IV therapy? Is that recommended?
Again, a port is indwelling venous access. It's usually done here in the subclavian vein. That's the most common place. Surgeon will make an incision, put in a line, bury it under the skin, sew it up, and then it can be accessed directly through the skin. It's right there. It's easy. We don't have to look for veins. We don't have to worry about stuff going into the tissues. It's going into the port, into the central venous circulation. And it's used for people who are getting things intravenously frequently. So I just arranged for one of my young male patients to have a port put in because he needs saline at least 3 times a week to stay healthy and active, and that's too much to do needle sticks. So we're going to put a port.
Oh, what about medical bracelets and medical ID tags? Is that something that people with POTS should get?
Somebody finds you, they're going to say, "What's POTS?" You know, you can't really tell them. But I've seen a lot of neat things on the forums and whatnot. A lot of clever jewelry and POTS things. It wouldn't hurt to have a medical ID to say I have autonomic nervous system deficiency or something.
I like wearing it. Like if I'm having a really bad day and I want to go grocery shopping and I'm afraid I'm gonna I don't know, not pass out, but get dizzy and sit on the floor in the middle of the pizza aisle. I want to, have something that tells people
Is it better to
there's
have
something wrong with
a hat
me?
or a T-shirt or a whatnot? Especially if you park. What if you park in?
You should get an ID bracelet. It's too difficult for you to even understand.
What if you park in handicap and people start giving you a hard time?
That's a hard one. I've dealt with
one.
that.
I know.
That is something for POTS patients though that they are eligible to get.
Sure.
Yeah.
Certainly, I've qualified a lot of people to have the disabled parking sticker. Just it makes it that much easier, and they can get that much farther when they actually get in the store and do something instead of having to retreat to the car. And
yeah, I don't want to waste my energy on having to walk through. Yeah,
especially in Florida where it's very hot.
Yeah. Guys had a lot of comments here. Is POTS caused by stress?
Caused by stress, I think that's a stretch, but certainly aggravated by stress. Stress is a physiologic function. Hormones, cortisol, we talked about aldosterone also before. We talked about body movement, and let's face it, stress, results in a lot of adrenaline and other hormones being produced, which are not well tolerated by the person who has autonomic dysfunction. So stress can certainly aggravate the symptoms. either, acutely or chronically, I think. So how do you deal with that? Well, meditation, biofeedback, or heart math, or programs that help you to control your autonomic nervous system and de-stress are useful adjuncts too, I think, in those settings.
We're going to take 2 more questions, and then we recommend you guys send any other remaining questions to our email, potsresearchproject@yahoo.com, and hopefully we'll have another webinar soon.
Okay.
One of the last questions was, what do we do about a flu shot this year? Did we get a flu shot?
I recommend the flu shot, unless, what I usually say to people is, first off, you ever had a flu shot? Did it make you sick? Most of the time they say no, I've never had a flu shot. You don't want to get the flu when you have POTS or dysautonomia.
You got enough to deal with.
Yeah, you do not want an illness that creates dehydration, fever, lack of energy, and all those things that you're already dealing with. So on balance, I say get the flu shot and avoid the flu.
Mm-hmm.
Or at least get your people that you live with that get the flu shot.
Yeah.
So they don't give it to you.
Yeah. Do you think that there's a gene for POTS?
There's certainly a gene for subtypes of POTS. Absolutely, there are genes that, like I said, are just being discovered. There's various genetic subtypes of the norepinephrine transporter, for instance, which is the main neurotransmitter of the sympathetic nervous system. So depending on how your body handles norepinephrine, and that's genetically modified, and then your response of your sinus node to stimulation and volume, all of those things are genetically determined to an extent. Absolutely. I think we're going to make great advances in that area in the next few years.
Awesome. All right, well, that concludes our webinar for tonight. Thank you guys so much for coming out. We had a great turnout, and thank you for asking so many wonderful questions. I hope that we
helped.
Yeah, I hope so. And again, visit us online at santamariamedicine.com. Thank you so much, Dr. Santamaria.
My pleasure. Thank you.
Thanks so much,
Good
guys.
night.
Good night. You want to turn off your webcam here?
I don't.
Okay. You go cam and then, yeah, that's off. And then, we're done.
Good job. You must be. You must be. Oh, God. That's funny. Honey?
Great. Yeah, what's the whole thing? I did it great. Of course, we could see what we could do. We could breaking up in some class. I hope this is on mine. It's just hitting the button. Yeah, well, right. Great. But yeah, then eventually we could see. I don't know why. Yeah, I know it. I know it's great. I know
It was challenging. No, it wasn't.